Good evening, good evening, good evening. Yeah, a warm welcome to all of you to Wellness 360 with myself, Dr. Kelvin. I'm super excited to host you one more time this evening. This episode number 6. Gradually, we are making progress. We are getting somewhere doing this Wellness 360. The aim of this program is to educate and to enlighten people when it comes to their health and wellness, because hey, the saddest thing you can ever have is to have all the resources available to you and yet you cannot get out of bed to enjoy them. And so it is my hope that as we go through the Wellness 360, as we take our time to understand our health, we'll have enough time to mitigate any challenge that we might have, so that we can indeed enjoy our wealth, because health is indeed the number one asset that's available to you. And so it's very, very important that you pay attention to your health, so that together we can enjoy life as God intended for it to be. So my name is Dr. Kelvin Owusu, and this evening I'm joined by an awesome gentleman, and we're going to have a fabulous discussion, and just checking to make sure that he's indeed ready. So Doc, if you are ready, can you put on your video so I know that you are ready? And I'm going to also ask you to unmute your mic as well before I do the introduction. So please, I've asked you to unmute your mic. Good. All right. So this evening, we are going to talk about a very, very, very important topic, which is also something that it's very confusing for a lot of women especially, but also confusing for a lot of gentlemen as well, because hey, whatever affects our ladies affects us as well. And so this is indeed a situation that affects a lot of women, and we are hoping that we are going to give them enough information so that should you find yourself in that situation, you're not going to panic, but you're going to actually take the right steps, take the right decisions to resolve this matter, so that it does not get complicated. What we are going to discuss is fibroid, and this evening you're going to learn a lot about fibroid, and we have just the right gentleman to take us through this very, very important topic. Now we have people joining us on Zoom, and we also have people joining us live on YouTube as well. And so wherever you are joining us from, please confirm that you can hear me loud and clear by commenting a yes in the comment section, and also let us know where you are joining us from. So if you are in Accra, Ghana, you can type Accra, Ghana and type your name as well, and let's know that indeed you can hear us. So if you're on YouTube, drop a comment. If you're on Zoom, drop a comment as well, and let's set the ball rolling. So at this point, I'm going to introduce our gentleman. He's an awesome gentleman. He's an awesome medical doctor, a specialist obstetrician and gynecologist operating out of the Eastern Regional Hospital and a couple of other places I'll let him talk about when he comes here. But he is indeed a professional's professional, and he is the best to take us through this topic right now. His name is Dr. Francis Woba, and I am happy to say that he's my mate from medical school. So Dr. Woba, can you hear me loud and clear?
Very well, loud and clear. Kelvin, how are we doing?
We cannot hear you.
Hello, Kelvin.
Okay, now we can hear you. Thank you very much. How's it going over there?
And it's fine, but currently I'm in Accra. I've come into the city to see how the city life feels like.
And enjoy the traffic as well.
Much traffic, I guess.
All right, thank you very much for honoring our invitation to be part of this session tonight, and I'm hoping that as our conversation goes along, we are going to learn a lot from you, because you are in the field every day. But my first question is a curveball. How come there are not too many female obstetricians and gynecologists in Ghana? What's going on? Do you people scare them away or what?
Oh, so I mean, I think the work of gynecologists is kind of a little bit very, very, very stressful. It requires a careful balance between medical life and social life. And because of the time-consuming nature of it, for you to be very effective, you'd spend a lot more time within the hospital space or environment. And, for a lot of women, they take on the responsibility of caring for the kids and the family. And that takes a lot of, a heavy toll on them. So it makes it difficult for them to be able to juggle the two portfolios, as you can imagine.
I can imagine. I mean, I spent a couple of months in the department, so I understand what you're talking about. All right, but let's get back on script. So we are talking about uterine fibroids. Now, my first question is it that important for us to actually be discussing it? What's the big deal about fibroids?
Yes, so fibroids are a very important component of health, women health in particular. And yes, very, very significant because fibroids are a very common occurrence among our population. And for that reason, it's important that the conversation around fibroids is had and persons understand what the significance of having a uterine fibroid or knowing somebody that has a uterine fibroid is, so that at least you know how to care for yourself and beyond that also have a very good health.
All right. So what exactly is a fibroid in the first place?
So when we say you have a fibroid, what we are simply saying is that some tissue within the uterus itself has grown into what we usually would call benign, which means it's grown excessively into a ball-like structure. However, that structure usually is not cancer. So it causes it forms it usually those cells actually it's part of the uterus. It's part of the muscle of the uterus. So when the muscle actually grows excessively into what we call a ball-like structure, that's basically what we call a uterine fibroid. So a uterine fibroid is not an extraordinary or something strange or something foreign. It's actually something that has grown from the normal muscles of the uterus.
All right, all right. So I'm actually showing a picture on the screen. I hope you can see it, and it's trying to tell us that these are fibroids. Can you take us through this picture? Tell us what exactly is going on here.
Okay, so if you look carefully at this picture, you'd realize that this looks so this is like the uterus, the part which is in the middle, and then into what looks like arms are the tubes. Yes. Okay. So when you have fibroid, and if you look at the uterus has got what we call layers. So we've got here, we've got the inner layer, and then we've got an outer layer. So the bulk of the uterine muscle is the middle layer. So usually fibroids originate from that layer. And then you would realize that they usually grow in what we call a circular form. And that's what you would see growing on top there, and it's whitish. See that white?
All right. Okay.
That's white structure. Yes. So those are the nature of fibroids. And then you would also realize that, so the fibroids can actually occur anywhere there is uterine muscle. Okay. So if it occurs at the top in a predominant manner, usually we would call that a fundal fibroid.
So that's the one I'm circling with the cursor.
Exactly. Now,
all right.
Dependent also on how deep or which aspect of the uterus the fibroid is found, it may affect the client or the woman differently. So typically, most of the fibroids would be submucosal, and I mean intramural. Okay.
Okay.
So intramural means it's inside the muscle. It's a big word just to mean inside the muscle.
All right.
Also will be subserosal, which means it's on the outer surface of the muscle. So the one on top there, which is the fundal, is subserosal.
Okay. All right.
Okay. Then we also can have what we call submucosal. Submucosal is the one which is yes, exactly. So that's a little bit inside towards the cavity of the uterus. So dependent also on where these fibroids are located, the symptoms or what the woman feels will be different.
Okay, now that's interesting.
Yeah.
But before you get into that, so does that also have an effect on how dangerous the fibroid is? So like does the location make the woman more likely to have complications? I think that's what you're getting to. I just wanted to bring it into more focus.
Yes. So where the location of the fibroid would determine the symptoms as well as how dangerous the situation can be. Now,
okay,
fibroids that are subserosal, that is on the outer surface of the uterus, these ones typically do not cause too much of an inconvenience. These ones typically do not cause too much of an inconvenience. What they do is that they usually will cause a lot of pain. They are the ones that cause some form of pain. And then they also cause a distortion of the abdomen. So you see women complaining that they feel their tummy is big. Because typically the ones that are subserosal typically would grow very big.
Okay.
So they would cause some bit of.
So basically, you are saying that the subserosal fibroids are the ones that can be confused for pregnancy because they make the woman's stomach very big.
Exactly the point. So those typically look really big, the subserosal.
Okay.
Yes.
Okay.
The intramural, which is the one inside the muscle, they will typically cause you to have a lot of pain when you have the menses, when you have your menses.
Okay.
Yes, they typically will cause you to have a lot of pain when you have the menses. And that's because, and they also would occasionally cause you to bleed a lot.
Is there a particular reason why they cause you to bleed at this intramural?
Okay, so typically when you have your menses, we expect the muscles to be able to contract as a measure to help reduce the blood loss. The blood vessels, or when the inner lining of the uterus is shed off during the menses, typically it's the blood vessels that are lying right beneath that lining are usually exposed, and then they tend to bleed. So uterus realizes this, it starts to contract, and it contracts in a way as to block the blood vessels and prevent them from bleeding.
Okay.
Now, if the fibroid is found within the muscle, it prevents or it causes a little bit of a problem when the muscle tries to contract. And that prevents the vessels from also being, the muscles from preventing the vessels from bleeding. So you tend to occasionally bleed a lot if you have intramural fibroids. Okay.
So basically, we are saying that depending on the location of the fibroid, you can have different symptoms. So even though fibroid is two fibroids can have totally different symptoms. That's basically what we are saying. So one woman's fibroid is different from another person's fibroid. So we should not confuse them all. It's not one fibroid for everybody. That's basically what we are saying.
Perfectly put.
Thank you very much. Thank you very much. In my other life, I was an obs and gynae specialist.
You know, I like. You should join us.
All right. But generally speaking, how common is uterine fibroid? Like how prevalent is it?
So, if you take for every 100 women, you would expect between 60 to 70 of them to have uterine fibroids.
Wow, that's very, very common.
Yes.
So you mean that out of 100 women, 70
Yes.
of them will actually have a fibroid?
Precisely. Now
that's 70% prevalent. That's serious. Okay. Now let's hear more. This is interesting.
This prevalence is for the Black population or the Negro, and that's precisely because it is actually this population that has a higher risk of developing uterine fibroids.
Okay.
Yes. So uterine fibroids are not too common in the Caucasians. It's very common among the Black race.
Okay.
Science has not been able to determine precisely why, but we believe the gene that gives the Black pigmentation, the skin pigmentation, which is melanin, plays a role formation of fibroids. And that is the reason why it's much common in the Black population.
Okay.
Yes.
But I mean, so if indeed 70% of women have it, then we should be diagnosing it much more often in our various clinical settings. Is it that big a deal if I have a fibroid? Like, should I be worried once they tell me I have a fibroid? Should I start screaming and running around looking for a solution?
So typically, as we have come to realize, the prevalence or the number of persons that actually have fibroid are a lot, but not everybody with a fibroid would have a problem. So typically, fibroids do not necessarily give you problems. It's a few persons that will have problems and would need medical intervention.
Okay.
And that's if you have a fibroid, if it's picked up accidentally or incidentally, you do not any particular symptom.
Relax. What do you mean by if it's picked up accidentally? I mean, how is a fibroid picked up accidentally?
So, hello?
Yes, I can hear you loud and clear.
Good. So typically, fibroids, for you to know you have fibroids, you would need to have a scan done.
Okay.
For a lot of women now, when they go for routine checkup, they would usually have a scan done as part of that routine checkup. And the doctor or the sonographer may tell you, oh, when I did the scan, I picked up the fact that you have some fibroids. And then also, some women in their pregnancy, when they go to do the scan to check on the baby, they usually will do a scan and they may just pick up incidentally that, oh, you have some fibroids, So those are what we call finding out that you have fibroids incidentally. Not necessarily that you had a problem and you went to check, and for that reason, they found out that, oh, you have fibroids, or the fibroids are the cause of your problem.
Okay, now I understand. The accidental finding was quite a shocker. So guys, those of us who have tuned in live or those who are watching the replay, if you have any question that you want to ask or something that's bothering you or bugging you, you can put that in the comment section, and we'll pose that question live to Dr. Woba, and then he's going to address it for us. Dr. Woba is a specialist obstetrician and gynecologist, and so he definitely is the right person to address all the confusion with respect to fibroids that you may have or any other gynecological issues that you may have at this moment. So feel free to drop your questions in the comments, or put up your hand, and then I will mute your mic to actually pose the question directly to Dr. Woba so that he can address it for you right now on this call. All right, now, Dr. Woba, so we've addressed a few things. First of all, you've told us that there are different types. That fibroid is a ball-like growth that is found in the womb of women, and which grows over time. Now, we've also found out that there are different locations, and based on the location of the fibroid, we can have different symptoms. Some of the symptoms could include distortion of the abdomen or enlargement of the abdomen. It could be excessive bleeding during your period. It could be pain. So all these are some of the symptoms that you can have should you develop a fibroid. But the next question I want to find out is, now you also mentioned that the fact that you have a fibroid does not mean that you should go and have an operation done, because not all fibroids are clinically significant. So then the question I want to ask you now is, at which point should I be worried that I have a fibroid? At which point should I actually do something about my fibroid, in quotes?
Okay, so if you have fibroids, the symptoms that we have mentioned, which is the fact that you may bleed excessively, or you have unbearable pain if you do have your menses, or if you also notice that there is what you call a distortion on your abdomen. So that's more like for cosmetic purposes. Sometimes, I mean, like you described earlier, the fibroids can sometimes be as huge as a pregnancy, and it's not a pleasant sight. Yes, so if you have any of these three, then you may or you will require medical intervention. So I will take them again. If you have excessive bleeding, if you have severe unbearable pain during your menses, or you've got an unpleasant sight of fibroid on your tummy, it has distorted your tummy. These three reasons are very good reasons for you to seek help for the fibroids. Now, the last one, which I deliberately left out, is this. If you have put in an effort to get pregnant and you are unable to get pregnant, and we discover that you have fibroids, that may be a reason why you are unable to get pregnant, and for which reason we have to take out the fibroid. I can see you are smiling.
Yes, I'm rolling up my sleeves, because now you are coming to a very important aspect. So now, let me understand what you are saying. You are saying that if you have put in efforts to try to get pregnant and you're not achieving the pregnancy, and they discover that you have a fibroid, then they would have to remove the fibroid. So now let's back it up a bit. Are you saying that fibroids are responsible for the inability of a woman to become pregnant?
Okay. Typically, the answer is no. Fibroids are not a direct cause of a woman being unable to conceive. However, if you are unable to conceive and we detect that you have fibroids, we may have to take out the fibroids.
Can you go by it one more time, just to be clear, so that there's no confusion at all? So you are saying that fibroids do not cause infertility?
Yes. However, if you have put in efforts to conceive and you are unable to conceive, and we know that you have fibroids, we will take out the fibroids because we believe it may have contributed to your inability to conceive.
Okay. Okay, your line was breaking a bit at that point. But if I understand you correctly, so let's assume that your business was already struggling to stay afloat, and then COVID-19 came in and there was a lockdown, and because of the lockdown, your few customers were not able to buy the product, then your business collapses. It doesn't necessarily mean that COVID-19 killed your business, but COVID-19 contributed to your business dying. So in this case, the fibroid is the COVID-19. It didn't necessarily cause your problem, but because it is present, it is probably contributing to your inability to get pregnant. That's basically what you are saying, right?
100% right. And I like the business twist to the whole concept.
just trying to bring it home, because this, and I'm stressing on this because I mean I've come across a lot of people, a lot of couples actually who have this confusion, and so it's very important that we clarify that indeed fibroids do not by themselves cause infertility, but if they happen to be there, they could contribute to the outcome, and so that's why when they'll be removed, and so it's one of the reasons for a surgery when you have a fibroid. But there's also another confusing thing that keeps coming up. So at which point, and now since we are in the area we are talking about surgery, basically let's just dive in. At which point should somebody have a surgery for fibroid? Is it and I'm asking in terms of age, because I remember when we were in university first year, I actually had a friend who had a problem with fibroid, and at the time she was advised to have surgery, and then later on it came up that she was too young to have surgery. So I mean, is there anything like too young to have surgery, and when is indeed the best time to have surgery for fibroid?
Okay, so there is nothing like you are too young to have surgery, and the best time to have surgery for fibroid is when you feel the problem you are facing is unbearable. That's the simplest answer that can be given. So if you have excessive bleeding, typically, when we say excessive bleeding, let me explain a little bit when we say excessive bleeding. Some women, as a result of their fibroids, can bleed persistently for well over 1 week into 2 weeks and even 3 weeks, causing your blood levels to drop to the extent that you may have symptoms of anemia. That is, you have dizziness and all that. Once you start to have that, you have gone past a place where the fibroid is needed. We have to take it out. Now,
well, is a fibroid ever needed in your life?
Now, there are some occasions where we're actually able to manage the fibroids with medications. So we call that a medical therapy. Now, if we put you on the medications, all it simply does is that it tries to slow the growth of the fibroid. However, it never takes away the fibroid. If we put you on the medications and the medications do not work, or the medications fail. Hello?
Yeah, we can hear you.
So if you are on medications and the medications fail or the medications do not work, then we will need to do surgical, give you a surgery to take out the fibroid. So you need surgical intervention. Now,
so you are saying that there's no medication to remove fibroid. That's what you're saying.
No way, no. We have medications to slow the growth of fibroid, not to remove fibroid.
But the last time I was in a trotro and some guy entered and said that he has medicine that he said when you take the medicine, first of all, he said that the fibroid is a result of the blood. When the women have their period, the blood doesn't flow completely. It's supposed to flow for 8 days. And so when it flows for only 2 days, then the rest of the blood will come together and then to enter the womb and then to form fibroid. So he has medicine that can dissolve the blood and then let the blood flow. And so you are saying that that man is a scammer or what?
It goes beyond he being a scammer. I think he's a criminal. This one is
but he had a lot of people sharing testimonial.
You see, most of the persons that actually are inside that trotro and sharing the testimony, truth be told, most of them actually are agents for the same person. I think Dan Parry would have to clamp down on these folks very soon. So yes, there is no medication that can cause your fibroids to melt. If we put you on the medications, it's just to slow down the growth of the fibroids. However, if the medications sometimes fail. And the medications also are not a permanent form of treatment. It's just temporal. It's a stopgap phenomenon. So if we put you on the medications, it gets to a point, you still would require surgery. If you also do have pain, excessive pain, each time you have your menses, we usually would treat that with pain medications. However, this also is just a stopgap phenomenon because you cannot chronically be on pain medications. At some point, you would need the surgery to take out the fibroids. Then the third group, which is those that have the very, very large fibroids, which is causing a distortion or is embarrassing them. You know, women usually like to look sexy and very, very nice, wear very fitting dresses. I mean, some have fibroids that are so huge or may even cause them to have a distortion of their figure. And for that reason, are unable to walk confidently in public. Yes, at that point, we need to take out the fibroid. And then the last one is the fertility bits, where if you do, you have put in the effort to get pregnant and you are unable to, and you have fibroids, because the fibroids may be a contributory factor, we have to take them out.
Okay. Okay. Well, this is a lot of information, and I mean, I'm excited because I am learning a lot of new things. I mean, I'm not the expert in this area, so every time I have an interaction with Dr. Woba, it's very enlightening, and you can tell that he knows his stuff. And as I said, Dr. Woba is a specialist obstetrician and gynecologist, and he works with the Eastern Regional Hospital in Kufuridua, and he also has other areas. And at the end of this call, he's going to share how you can get in touch with him, so that if you need his services, you can always reach out to him and then get your issues dealt with in privacy, obviously. So I have a few questions I want to ask from the public inputs. People send inbox messages, and so I'm going to just read some of the messages. So basically, this lady wants to find out. So she has been diagnosed with having fibroid, and they actually scheduled her for surgery. But every time it's time to have the surgery, they tell her blood level is low. What can she do?
Okay, so with that, the option is this. We need to build up her blood levels before the surgery. The first option is first to give her blood. We'll give her blood, but we will also need to stop her from bleeding. So we have to induce what we call a temporal form of menopause, because there's no point in giving you blood if you are going to lose all that blood anyways. So we are going to give you induce a temporal form of menopause using medications. Then we are going to give you blood to build up your blood levels. And in this particular case, this form of surgery would actually then fall under what we call an emergency surgery, because it doesn't make sense that each time you build her blood, you reschedule the surgery, because when she goes home, she's going to bleed again. So you induce menopause temporarily, you give blood, and then you do the surgery.
All right. So this other lady is asking, I bleed when I have my period. I change my pad about 3 to 4 times a day, and I bleed about 8 days sometimes. Is that normal?
This is a very interesting question. So the point is this: for menses, every woman is different. It's only that woman that can determine what is normal. Now, I say this because first, you see, we need to establish what the pattern is for you. Has it always been the case that you bleed for 8 days? Has it always been the case that you use 2 to 3 pads a day? If that has always been the case, it may just be normal for you. And the pads you are using, are they usually typically soaked? Do you have clots when you have your menses? All these would help us determine if the pattern for you is normal or not. Some women are typical what we call heavy menstrual bleeders. They bleed heavily when they have their menses. And some people are light bleeders. So for the light bleeders, they typically would bleed just about 2 days. And they may just use about either 1 or 2 parts in a day. So for the menses, we have what we call a spectrum. You would fall within that spectrum. Normal or regular menses usually would fall between 2 days to about a week or 8 days. And initially, for most women, the first few days are usually heavy. The subsequent days are usually light. So we need to know if she has realized an increase in the number of days. For a woman that was initially bleeding, let's say, for 2 days, if she starts bleeding for 8 days, it becomes a problem.
Okay.
Then in that sense, we can say that, oh, that's too much. So that's why we need to determine the pattern. And she's the best person to determine that pattern.
Okay, so woman, know thyself so that you can get the right information for yourself, because there's no one size fits all solution. Well, this question is interesting. I don't even know if it's a question. So, doctor, I've been diagnosed as having fibroid and I've been told I need surgery, but I'm afraid. What should I do?
Yes. So yes, it is pretty okay to be anxious or to be scared. Surgery is surgery. However, what you would require is that you need to have a conversation with your doctor. He would have to counsel you to understand what goes into the surgery. In current days, surgery has been made very much safe. It is not like in the past where you go to sleep and you don't wake up. For now, most of the surgeries that we do, they are not very complicated. That's to say, you are virtually awake. We are talking with you while we do the surgery. We just numb a little bit, some part of you while we perform the surgery. You would need to speak with your doctor, and you may need the services of a psychologist. But like I said, it's very, very normal to be anxious before a surgery. Yes, every surgery is a very important moment of your life, and it is important that you take your time to determine whether you need it or not. If you need a second opinion, always important to get one before you go for the surgery. Yes.
Okay, this one just came in. Doctor, is it true that once you have a fibroid operation, it means that all your pregnancies you'll be delivered by surgery?
So if you do have a fibroid surgery, it does not automatically mean that all your pregnancies would be by cesarean section, or you need to be delivered surgically. It depends on the extent to which the surgery went. If the surgery was very extensive, and by extensive, what we mean is we usually would say it had to breach all the layers of the uterus. Typically, that would require that you are delivered via a cesarean section. If, let's say, you had what we call a pedunculated fibroid, that's like the fibroid is just on some small pedicle. I cut it out. I mean, with that one, you don't truly need any. You can deliver by yourself. But most of these will be communicated to you by your doctor. So you would have a conversation with your doctor, and your doctor would inform you the extent to which the surgery went, and as to whether subsequent deliveries would be by cesarean delivery section or vaginal delivery.
All right. So again, this is a case of it's a personalized thing. There's no general instruction for every fibroid intervention. So please do talk to your physician. Talk to your gynecologist and get the information that's specific for your situation. Thank you very much, Dr. Francis. So there's a question on the platform, and this is coming from Micah, and she's asking, can one ever be cured of fibroid? Does lifestyle vis-a-vis eating healthy and exercising have any effect on fibroid?
Pretty much loaded, and this also fall. So, it will be difficult to cure you of fibroids because, like we said, fibroids actually there's a genetic predisposition to fibroids. And fibroids come from the uterine muscle. Now, during surgery, what typically the doctor or the gynecologist would do is that you try and take out all visible fibroid. All visible fibroid nodules would be taken out. However, there are some fibroid nodules that are not visible to the eye. Now, those are
is that if you for nodules, right?
Exactly. Those are so difficult. It's impossible to take out every fibroid nodule. So therefore, we say it's not possible to cure you of fibroids. Okay. If we take out the fibroids, over time, they may come back. Over time, they may come back. And then also, she wanted to know if there were any foods that may improve your chances of preventing or prevent you from developing fibroids. So, literature. So most of these are actually anecdotal evidence, right? You hear about red meat, and you hear about probably carbohydrates, the dietary excessive carbohydrate consumption and all that. Research has not truly been conducted. I mean, by research, I mean the evidence coming from that part is not very, very strong. However, living healthy or eating healthy has always been helpful in preventing a lot of medical conditions. So I strongly suggest that or believe that we should all eat healthy, remain healthy, and then we can prevent fibroids as well.
All right, and I think this will be the last question. Somebody wants to know if fibroid surgery in Ghana can be done or is done through keyhole approach, keyhole surgery.
Yes, fibroid surgery. So keyhole surgery is basically what we call laparoscopic surgery. Yes, we've got some centers that do laparoscopic surgery. Let me just add a caveat that laparoscopic surgery it's done typically for very small fibroids. For very large fibroids, like the African fibroids, which we find in a lot of our women, you still will require open surgery. Some persons try to do it laparoscopically and take it out by what we usually call musculation. So musculation typically is like you blend the fibroid and then you suck it out. But that particular form of doing surgery and then bringing it out for very big fibroids is not advised. So if you do have a very big fibroid, the best advice would be to have the open surgery and then have it taken out. Unless it's very small, then we can take it out laparoscopically.
All right, so I thought that was the last question, but there's a question that just popped up. Please, my mom had fibroid many years ago. I'm 36 now. Is it possible that I might also get it?
Yes, very possible. So for a lot of medical conditions or gynecological conditions, it runs within the, how do you call it, family line. So let's say if your mom had it, high chance, yes, you may also develop it. So yes, the simple answer would be yes.
All right. Well, thank you very much. This has been a very educative session. And I have personally learned a lot. And I mean, I hope that you on the call have also learned a lot as well. In fact, if you have learned something from this session, please do post in the comment section. Put a yes in the comment section. Let me know. The feedback is always good. Let me know that you have indeed learned something. So put a yes in the comment section if this has been an enlightening session for you, and so that we know how to improve on it next time. So feedback is always important. Feedback is always desired. So thank you very much for that feedback. Oh yes, thank you. Micah is already commenting. Daniel is commenting. Good. Thank you very much for that feedback. If this has been an insightful session for you, do give some feedback. Let's know that it has been an insightful session for you. Thank you very much for that feedback. All right, so Dr. Woba, as we are wrapping up now, I mean, just to give a recap, we are saying that the Black people, Black generation or Black race, like those of us in Africa, there's a 70% prevalence of uterine fibroid. As if you take 10 women, 7 of them are going to actually have fibroid. Whether they know it or not is a different matter altogether, but that's the prevalence. We are saying that the symptoms of fibroid include pain, excessive bleeding, distortion or distension of the abdomen, and other things. It may or may not be related to infertility, or rather, if you are struggling to achieve pregnancy and they discover that it's a fibroid, the chances are that they are going to remove that fibroid. And so these are some of the symptoms that come with fibroid. And then the treatment of fibroid is basically surgical. There's no medical treatments that can take away fibroid completely. Any form of medical treatment is temporary, just to reduce the size of the fibroid so that surgery can be carried out eventually. And so if you joined us today and you yourself are dealing with fibroid, or you know somebody who's dealing with fibroid, well, these are the highlights, and you can share with that person and get that person to seek help from the right source, because there are a lot of people out there who are also using fibroids to line their pockets. So please get your information from the right source. Now, Dr. Woba, can you tell us, for those of us in Accra, how can we get you to attend to us or to our relatives? I mean, do you have any place in Accra that we can link up with you and get your services?
So in Accra, I am at the Bank of Ghana hospital at Cantonments, and I consult there every Mondays on between 9 a.m. to about 1 p.m. I also do consult at Nyaho Medical Center, and it's also on Monday, and that is between 5 p.m. to 8 p.m.
Awesome. Thank you very much. So that's Dr. Woba, who consults at the Bank of Ghana clinic or hospital, on Monday mornings, and Nyaho Medical Center on Monday evening. So do schedule a session with him. You can link up with me. I'll give you the means to contact him, or if he's willing, he can also drop his email address or contact in the comment section so that you can reach him directly. But thank you very much for spending your time with us this evening. We've learned so much from this session on uterine fibroids and what we need to do should we experience any of these symptoms. So do get in touch with the right people and get the service that you need at the right time, because fibroid can be managed, but if it's getting out of hand, it needs to be treated immediately so that it doesn't cause you discomfort or distress. So once again, this has been episode 6 in the Wellness 360 with myself, Dr. Kelvin, and I'm super excited that you spent your evening with me here this Wednesday evening. Join us again next week, where we come your way with another educative session about your health, because as we started by saying, your health is indeed your most important asset, and so long as you are in good health, everything else is possible. So let's do that. Let's make that happen, guys. Let's stay healthy so that we can go ahead and build the wealth that we desire and deserve. Thank you very much, guys. Have a lovely evening. Stay blessed. Dr. Kelvin signing out. And Dr. Woba, thank you once again. Thank you very much.
Thank you so very much. So very much for your time and having me. Thank you.